Congresswoman, thank you for being with us today. Can you talk about how Democrats should be messaging this bill? Because there is a lot in it, and it is our understanding that you have a personal connection with the issue. And if you could share some of that with our viewers, I think it will really illuminate the real-life stakes of what we're talking about.
Yeah, well, first off, thanks for having me on. This big, ugly bill is devastating. It's devastating for my constituents. It's devastating for millions of Americans across this country. I ran for Congress. I ran initially for the Delaware State Senate 5 years ago because of my experience as a caregiver to the man who would become my husband, Andy, during his battle with cancer. Andy was in his 20s when he was diagnosed with cancer. And despite that diagnosis, from the first moments in the doctor's office to getting treatment, we knew how lucky Andy was. We knew how lucky he was to have health insurance that would allow him to get care that would hopefully save his life. And while he was able to get that care, while we were able to have precious time together, for me to be there by his side to support him, care for him, marry him when we found out that his cancer had spread to his lungs and was terminal, up until his last breath, we knew how lucky we were. And I ran for Congress because I do not believe that in the wealthiest, most developed nation on earth, that time and that ability to get care should be a matter of luck. I believe it should be the law of the land. And I hope to be entering a Congress that was expanding access to healthcare, that was lowering the costs facing patients. But the reality is that this big, ugly bill does anything but that. I think it's incredibly important that we make, first of all, crystal clear that any Republican in Congress who voted for this bill cannot call themselves a moderate. This is the most heartless and devastating bill that we have seen go through Congress in decades, perhaps in a century. This is a tax giveaway to Donald Trump and his billionaire donors that they just partially pay for by raiding the health coverage of millions of Americans. Look, there are, as you mentioned, a lot of terrible things in this bill. But in addition to putting at risk the health coverage for 15 to 17 million Americans, 1 in 5 Americans rely on Medicaid for health coverage, and millions within that program are at risk of losing their coverage. In addition to that, this is overall the single greatest remake of the American healthcare system in a generation or more. This is Trump care. And Trump care means 15 to 17 million Americans more not having coverage. It means rural hospitals closing across this country. And when you decimate a critical leg of the healthcare stool, you are impacting all patients who will see higher premiums, who will see longer wait times. And Donald Trump and congressional Republicans, they own that. Every single time a patient loses coverage because of this bill, they will own it. Every single time a rural hospital closes or a federally qualified health center closes, they will own it. Every single time a patient, not just people who rely on Medicaid, but people who rely on their employer for health insurance, every single time they have to pay a higher premium or have to wait longer to get care because of this bill, Donald Trump and congressional Republicans will own it.
Representative, you laid out, I think, a very compelling indictment of Trump care. And I want to call to your attention because I think what you've said will be very interesting in the context of what Republicans are saying and plan to say. I note from Axios the messaging that the GOP plans to go on or intends to go on. They plan to message their legislative victory by branding Democrats' opposition as voting to raise taxes on small businesses and American families, according to an internal memo first shared with Axios. Quote, every Democrat voted to hurt working families and to protect the status quo. House Republicans will be relentless in making this vote the defining issue of the 2026. I find that actually rather daring in the face of what you've just described, the impact on Medicaid recipients, the impact on small businesses. What's your response to that strategy? Do you think just, saying, hey, this, Democrats voted to hurt small businesses and working families is going to be a winning message?
Well, I think it's bullshit, and I think the American people know it's bullshit. This is one of the most unpopular bills to ever pass in Congress because the American people understand that Donald Trump and congressional Republicans passed a bill to line the pockets of their billionaire donors. They gave temporary table scraps to some working people and some small businesses, while at the very same time decimating the health coverage of working people, decimating the individual marketplaces that so many small businesses rely on to help give health coverage to their employees. And the American people see through it. Look, I think the Republicans can puff their chest and pretend like this is a great bill, a beautiful bill, but the American people already see through it, and they'll continue to see through it as the ramifications of this bill take effect. Some of the ramifications won't go into effect until after the midterms. We're going to start seeing state governments have to cut their Medicaid programs in the months and year ahead. We're going to see rural hospitals closing. In fact, we already saw a rural hospital on the day of the vote close down and say the anticipated cuts in Medicaid are the reason why they're having to close their doors. And so I think the Republicans can try to message that, but the American people understand that this bill does very little for working people. It does very little for small businesses. What it really does is it lines the pockets of the wealthy, and it actually decimates the health coverage, food assistance for working people, and is a net loss for working people and small businesses overall.
Right. So these are the pieces that they are planning to lean into. This is what they think they've got in that big bill that they can actually sell. The tax cuts on overtime and tips. They will not likely mention that it's up to $25,000, that it only lasts until 2028. There were some moderate child care subsidies in there that they're going to take a victory lap on. They're going to take a victory lap on work requirements for able-bodied adults. I thought this headline about Katie Britt actually kind of articulated the challenge that you as Democrats are up against. Expanded child care tax credits boosts Britt's pro-family GOP Senate agenda. The challenge is you cannot take the pieces of this that are arguably pro-family, like some of the child care subsidies, and say that was worth throwing 12 million people off their health care for. That was worth excluding the American citizen children of undocumented folks. So my question to you is, how do you get out from under their desire to oversimplify this? We've got about 30 seconds left.
Well, first off, I would say that there are provisions in this bill that Democrats would have supported if they weren't in a partisan vehicle. But even beyond that, we're not going to see child care costs lower because of a small tax credit. What we're going to see is prenatal care and postpartum care decimated for millions of new moms. We aren't seeing a proposal for universal child care. We're not seeing a proposal for paid family and medical leave. That's what Democrats will be offering, actual policies that widely benefit the American worker and American families and actually lower those costs, not cutting health care for new moms who already are seeing a maternal health crisis in communities across this country.
Delaware Congresswoman Sarah McBride, thank you so much for being with us. And